Thank you all for being on this presentation. We're glad to have everyone here. So hello from Oakland University. For those that aren't familiar, Oakland University is about 20 miles north of Metro Detroit. So not exactly a rural area, but certainly we want to make sure that our impact and we're affecting older adults and individuals across the entire state of Michigan. And that's really what Dr. Arena and I have kind of been working on that you'll hear a little bit more about. And maybe it's something that can be of interest to your health system or to you professionally, or maybe even personally, because sometimes we're all in that sandwich generation and we have older adults that we help care for or live with that might need services to help them prevent falls and stay safe and active at home. So um, there we go. So as we said, here's our presentation title. And just in case we weren't introduced, I think that's probably all the introduction. I think Amanda did a great job. Sarah, anything else that you want to say about yourself or?
No, I mean, maybe the only thing that we could add is a little bit about our clinical practice.
Sure.
I have actually practiced for 35 years at a health system in the Detroit metro area for about 10 years in acute care. So was certainly seeing people after they had those falls. But then made a transition into the home healthcare environment. And so was much more engaged in the community and really seeing the place where people lived and were actually having many of these falls. And so that's kind of where the knowledge I kind of bring to this is my personal experience in the home healthcare and community care setting. So, Chris?
Yep. Yeah. And I'm, as Amanda said, I'm board certified in geriatrics. So I work mostly exclusively with older adults. I actually work in the hospital. I was at the hospital. These are my lovely purple hospital scrubs. So I was actually there this morning seeing patients. So in addition to professors and faculty members, we're both quite active in the clinical realm as well. So we do have some disclosures. So we kind of created this program called Hop Up PT, but really it's just kind of to train other therapists to to be able to kind of do our protocol and program. And probably the other disclosure is that we have had multiple generous funding support from the Michigan Health Endowment Fund Healthy Aging Grant, and also we've gotten grants from the Michigan Department of Health and Human Services as well. So we're very thankful for those. So really what are we hoping to accomplish today is talk a little bit about prevention focused physical therapy. I think that's one of the big misnomers or misunderstandings is that you have to wait until something's wrong to see a physical therapist. Some of you guys on this webinar probably already know that, but you don't have to wait until you fall or you hurt yourself or you have back pain. If you feel like you're at risk or something's even coming on, how do we do that? And especially for older adults, sometimes they'll say things like, I haven't fallen yet, so I don't need physical therapy. And then we say, exactly, that's why you need physical therapy, so you don't fall. Let's not. Yes, we can put you back together after you fall, but let's not wait for that. So, what are kind of some of those evidence-based strategies for implementing fall programs, and then also talk about kind of what are the practicalities to help manage this patient population and work upstream just a little bit more. So this is a little bit of a continuum. Again, for those that are familiar with physical therapy, maybe had it themselves or just kind of familiar from the health system standpoint. On kind of the far end, we have where I work, where I was at this morning, patients were in the hospital. They're not community dwelling, and oftentimes they're quite frail. They're not medically stable, and they can't live at home right now. Home care, where Sarah practiced, is they're medically stable, but they're really not able to safely leave the home consistently. And maybe they can kind of get out every once in a while, but it's tough for them. Then there's outpatient therapy. So I hurt my back. I need to go in for a few times a week to a clinic or an office or something like that, and they work on me and can take care of me. And then again, where someone is not frail but can always leave home, that's where really kind of community partners fit in. So, community senior centers, area agencies on aging, private exercise classes. So think you're like Silver Sneakers, things like that. So there's kind of a continuum, but there's a gap for those folks that, yes, they can sometimes leave home, but they're really kind of on the border of being clinically frail, where they really need early identification. So they're kind of right on that verge of going into that home care. So that's really what Sarah and I have kind of been working on, is helping to fill that gap, especially with some of these older adults where maybe even home care, outpatient therapy are not always consistently available because of resource limitations. So and that's kind of where the program that we came up with, called Hop Up Physical Therapy, which will tell you what the abbreviation is in just a little bit here. So really, we've kind of partnered with the community-based providers with this, and this also includes healthcare providers. To anyone, really, there's no wrong point of entry into a community-based physical therapy program like Hop Up Physical Therapy. So, your doctors, nurse practitioners, other healthcare providers, even patients themselves, or family members could kind of call up and say, we need to have this person, they might be at high risk of falls. So really kind of also focusing not necessarily just on fall prevention. I think that was one of the things that we maybe not necessarily made the mistakes, but as a healthcare system, we didn't learn enough to understand that fall prevention is truly multifactorial. It is not just, oh, my legs are weak, or, oh, I'm getting dizzy. There are a lot of social determinants of health that are related to falls. And that's really kind of the program that we've kind of worked through the evidence and the research to really focus in on, yes, healthcare and quality, but can they access their community? Do they have the social support network? Do they have a social and community context? So do they have a social support network that kind of helps nudge them, maybe if they're getting a little bit depressed or kind of lonely, or everyone kind of gets those winter doldrums where you're not necessarily going out. And especially in parts of upper Michigan where you're hammered by snow, these are the folks that really are at risk, because, for those folks that can't consistently get out because of weather issues, fall and winter might be very challenging times. So not necessarily just focusing on leg strength or balance, but also kind of focusing on this. And that was part of what the research kind of said that needed to be offered for this patient population. The other thing is that the American Physical Therapy Association a few years ago did a study and actually found that physical therapy-based falls prevention saves money. It actually saves about $2,100 per episode of care. And they define it as the quality age-adjusted life year. So that's how long someone lives and the quality of life that they have. And they're basically, when you're kind of adjusting for those things as well, it's about $13,000. The other thing that was kind of interesting is when Sarah and I are working with other community centers, there is also a community economic benefit. When an older adult falls and they need to go into a nursing home, or they need to liquidate their assets and move into a assisted living facility, they're kind of taken out of the economy as well. So, they're not visiting local small shops. They're not, using grocery stores. They're not going to coffee shops. They're not doing things that are kind of part of the economy as well. So not that it's all about the dollars, but there is an economic impact, a positive economic impact to keeping older adults safe and active in their homes. Again, we're probably preaching to the choir with many in this group, but thought we'd get everyone on the same page. So what is Hop Up PT? I finally got to the point where we can define it. It is home-based older persons upstreaming prevention physical therapy program. Basically, lack of a better term, it's a clinical protocol that physical therapists will follow. And again, after they kind of have that point of entry into the system. So really, any physician, family member in Michigan, in the state of Michigan, patients can get direct access to physical therapy, and you can actually get it through Medicare too. You just need the doctor to sign the plan of care at some point. So you don't necessarily have to have the person go see the doctor. They can just sign the plan of care. So either the community center staff or the physician can identify older adults who are at risk and then refer them to a local physical therapist. So we're really talking partnerships between local physical therapists in your region, and maybe your health system and community partners. So ideally, it takes a village to kind of help keep some of these older adults safe and active. Um, but it really kind of, I think the key term is that upstreaming and prevention in the abbreviation. So upstreaming is really that, let's not wait for something to happen. Let's catch it early because it's going to be much better for the patient and it's going to save healthcare dollars. So really our goal kind of when we started this project, and it's been a research project where we probably have certainly over a dozen publications in peer-reviewed research, and we can send you some. But if you want a good cure for insomnia, we can send you all of them. So feel free to shoot us an email. We can send you more reading than you probably wanted, which I doubt most people want. But if you want to learn a little bit more about the protocol and kind of how it works and what it is, we're happy to share any of those. They're all published research, so everything is kind of freely available as well. So yeah, we're hoping to empower those older adults to stay safe and active in their home and community by providing those early preventative interventions. Again, the ones that are risk of being homebound. And I'll even say that, some of you guys might have in your healthcare system, kind of a little bit of a cliche is say that like if there's a 1/4 inch of snow, these are the folks that are probably canceling their appointment to come to you or your healthcare system. So where they're that nervous that it's raining too hard or it's snowing, that they're not going to go out. So if you're looking for like what might be that sweet spot patient, that Goldilocks patient or client, that might be them. So really kind of here is that upstream healthcare. So again, you can see, let me get my little laser pointer here. So you can see upstream healthcare, we're doing exercise, we're catching patients, treating them before they fall so they don't have injuries and we have to do expensive surgery, rehabilitation, hospitalizations. And there is a big cost to that because 1 in 4 older adults will fall every year. 25% will fall every year. And that actually increases when they get closer into their mid 70s to 80s range. It's much more frequent than that. One fall without a hospitalization, but going to like see your doctor, getting x-rays, $3,000 out the door for the healthcare system. If someone has to get hospitalized, usually the average cost is about $30,000. So it's not a small amount that, and again, older adults are paying 20% copays if they don't have a secondary insurance. So it can be quite detrimental to them. So, so as you can see, this is kind of the general gist of the protocol. Visit 1 is the initial evaluation. Usually takes about 90 visits or 90 minutes. And that later in that week, we do visit 2, which kind of has our prevention interventions, and then we switch to about once a month for visit 3, 4, and 5. So if you've ever had physical therapy, you're going in for 3 times a week for 4 weeks. It's not really like that. It's once a month. So, and we kind of equate it a little bit more toward like a dentist model. So, you don't see your dentist every week, but you might see them every 6 months. And if you have a cavity or you have risk of having cavity, you might need to see them more often. So then at months 4 through 6, we do telehealth visits. So usually these are virtual visits. Sometimes it was a phone call, sometimes it was a FaceTime. Certainly we did this project with Henry Ford, and they actually used their in-house telehealth system as well because it was HIPAA compliant and it met all the compliance documents. And then we do an in-home discharge evaluation. And really the discharge evaluation from therapy is a big part of it is identifying the resources in their community to keep them safe. So if you remember that kind of longitudinal arrows where we were kind of saying, okay, either get into outpatient therapy or the community center. This is, let's identify, do they need outpatient therapy? Probably not. But what services are available in the community that will help keep them safe and active?
Chris, can I just tag on one
Please.
clarifying point? Because I know you use the word we, and I just want to make sure I'm clear
Oh,
on
good
this, that
point.
it's
Thank you,
not
Sarah.
you and me doing this. We really just provide the training, and I'll talk about that's available. I just wanted to make sure that it was clear it's not us seeing every older adult in the state of Michigan.
Yeah.
It's us training all
Local
physical therapists that are interested and anyone within a healthcare system. So it's a physical therapist. So just for a point of clarity.
Yep. And we've done several different models when we've trained the therapists. Sometimes they have been independent physical therapists if a health system did not have a physical therapist or the community center did not have a relationship. Or we've also done it where, like, we did it with Henry Ford Health System down in Detroit, and they wanted to use their physical therapist. So there's lots of different models for doing that, and it really basically is tailored to what you and your community, what relationships you might have with local physical therapists, because there are 300,000 physical therapists in the United States. So I'd say when in doubt, put them to work. And we'll talk a little bit more about the payment. What we actually have found is that we've done some research with Henry Ford, is that this service is being paid for by the insurance companies, and there is about a 14% positive operating margin, which will,
You're
again,
stealing my thunder
I
for
know, I'm so
later, Chris.
sorry.
Don't give
I'm,
away the big exciting thing.
I
Yeah,
know, I couldn't resist. Sorry.
that's okay.
So, kind of what does this look like? Ideally, the older adult is safely aging in place. They might go through some type of healthcare or community services. Could be their doctor, could be Meals on Wheels, equipment loan clauses. They're engaging with the healthcare and the community, and that healthcare or community provider then identifies, oh yeah, this person's kind of at risk. So then refer them to the Hop Up PT program or the Hop Up PT provider that's in their community. And really, these are kind of some of the different domains that the therapists will look at. So it's not just balance and falls, but it's also home safety, blood pressure. Can they access the community, and what do they need to do that? Screening for polypharmacy and medications. Are there comorbidities being managed? Vision and hearing, even cognition and depression, and finally, health and diet. One other point that some people might not necessarily be aware of is that physical therapists are trained at the doctoral level all across the United States now. So anyone that graduates from a physical therapy program is a doctor of physical therapy. And then hopefully once they're done with the Hop Up PT program, they're going back to safe aging in place. Now, in some cases, things get a little bit more complicated. We also want to make sure that the family and caregivers are aware of what we're doing. And because they're going to be the support network to help keep that person safely aging in place. Then in some cases, they might need traditional physical therapy. We've actually gone into some homes. When I say we, that actually was Sarah, and sometimes me. And we've seen folks that, like, whoa, you've actually got really bad back pain, or you have a shoulder issue, or your balance is bad enough where it's not prevention anymore. Now we need to kind of get them in for traditional physical therapy, kind of that more conventional 3 times a week for 4 weeks that you kind of might be used to. Then even, using some of our outcome measures to predict future falls and morbidity. And finally, in some cases, we've even seen medical issues. So we've discovered high blood pressures, other medical issues that they really do need to be medically managed. And maybe they're not appropriate for that ongoing Hop Up PT program, but they got referred by some community provider or a healthcare provider, and then we identify that there was an issue. They got something medically fixed by their doctor or medically managed, and that helps keep them safe and aging in place. And that's what the ultimate goal is. So, even if not every patient goes through the specific Hop Up PT protocol, they've got something medically fixed, and that's a win in our book. So who are really kind of the program candidates? And this is a little bit flexible too, because this was kind of our recent clinical protocol. Really, again, referred through, there's really hopefully no wrong door. Ideally, we kind of set it where, we told community centers, hey, if you see that Mrs. Jones has a hard time getting out of the chair when she's playing bingo, give us a call. Or if you've seen Mr. Smith every day at the community center, and then you haven't seen him for a week, give us a call. Then we can kind of go in, see what's going on, and give them a tune-up to get them back out into the community. But for our purposes, ideally, for the most part, we worked with Medicare, so they were 65 years or older. Hopefully, they didn't have any recent serious medical events because that they still probably do need physical therapy, but that's more like the traditional physical therapy. And if they didn't have recent physical therapy or a hospitalization, because again, maybe they do need more intensive services than a prevention program. So as we said, what's kind of provided to the participants? They get those 6 in-person home visits and 3 telerehabilitation over that 6-month time frame. So it really embraces behavior change. So we kind of, give them the tools, check in on them, give them the tools to make that next layer of behavior change, check in on them, and really utilize some of that motivational interviewing and health coaching. That's probably a big part of our training for the therapist is getting them trained in motivational interviewing, health coaching, and things like that. Then also even home and living environment recommendations, balance exercises. I will probably say even the home environment evaluation and recommendations, that's where it really is beneficial to have a therapist in your community because they know the resources and they're kind of in the community and connect you with, connect the older adult with the area agency on aging that might connect them with handyman services and things like that. And as we said, referrals to other medical professionals. So this is a really busy slide and we can send this all to Amanda for her to send out to all of you, but this is kind of what the evaluation looks like. So it's very comprehensive, it's very thorough. Again, it doesn't just look at balance, but it also looks at healthy lifestyle, their comorbidities, their medication reviews. We take orthostatic blood pressures. We calculate their frailty risk. So it is a very involved process. Again, we can send you articles that have this in much more depth and actually the validity and reliability behind a lot of these tests as well. So that's kind of the general gist of the evaluation. So then here's kind of what visit 3 might look like. We actually, again, all of these are delivered for the most part into the person's home. We're looking for any health changes, checking their blood pressure, even checking things like their weight to see if they're gaining or losing weight from a medical issue or other reasons. We did kind of do an activity monitor device. So sometimes we'll give them, we've done things where they have like a Fitbit or even just a pedometer. If they already have a fancier thing like an Apple Watch or something like that, we kind of talk to them about how to use that to improve their health. Because some people, like a relative just buys it for them and they slap it on and yep, it tells time and I can talk to my kids with it. But there's a lot of health opportunities for that we can kind of use to help them with activity monitoring through different needs. We review the Otago exercise program. If you're not familiar with the Otago exercise program, it is the one endorsed by the American Physical Therapy Association. It's a series of 4 different levels of fall and balance exercises. We've even got some videos that, again, I'm happy to share if people want to learn more about what the Otago exercise program. It was actually out of Otago in, I think, New Zealand or something like that. So it's actually kind of a worldwide known evidence-based, evidence-informed exercise program. Talking about healthy lifestyles again, how's it going with any of those home modifications, and then schedule the next visit. So you can kind of see that for the most part, those kind of go on similar like that. This is kind of the Otago exercise program. I'm not going to show you the whole video because it's 9 minutes.
We'll do 5 of these. 1.
So you can see we actually have exercises that the person can watch. Sarah, is the audio going on this?
It's pretty quiet, but
Okay.
I think they can get the idea of what's happening, and there's pretty much right now it's just counting anyway.
Yep.
The last balance exercise before we transition is one leg standing. You're going to lift one leg up off the ground at a time and hold it up for 10 seconds. If you need to use support, that is okay. 1, 2, 3, 4, 5.
I think you guys get the idea. Again, I'm happy to send you the whole link if that's something that you'd be interested in seeing. Whoops, I don't want to go to YouTube. Oh, now it's going to be, hold on just a second. Now it's playing it on YouTube. I don't actually want to play it. There we go. Okay. So I think this might be where I hand off to Sarah.
Yes,
So good timing for
absolutely.
a
And
transition.
yes, perfect. And so Chris has given lots of information, but there's tons more that we could talk about with the program. Certainly, if someone is interested in learning more, we're happy to meet with people individually offline. But I want to kind of switch now and talk about some of the outcomes of the randomized control trial and then a little bit about some of the training. So Chris, if you want to move it to the next slide. We have, as Chris said, I think we're actually at 16 or 17 articles that are published, but this is a really important one from 2021, which we actually had 144 Michiganders that were randomly assigned into different groups. Some of them actually participated in Hop Up, and then the next 6 months we just monitored them, and then the other half of the group didn't participate for 6 months and then participated. So kind of a crossover design of people really in the lower peninsula, but a vast array of communities throughout the lower peninsula of Michigan. And the purpose was really to describe the outcomes of the Hop Up PT program when we compared participants to non-participants. And I will give you the QR code because this is an open access article with all the details. But one of the, Chris, next slide. Probably the most notable thing that we actually found with this is that of the individuals that participated who identified as either being moderate or high fall risk, and we did have low risk participants who had improvements with the program too. But pulling out those moderate and high fall risk participants, we had an 8-fold reduction in falls. So whereas we had almost 48% of the control group or the people that didn't participate fell in that 6-month period, only 6% actually had falls in that 6-month period. And again, the article outlines the details, but both groups were about a mean age of 77, similar male, female, pretty much a similar comorbidities. So this really was a pretty significant and exciting finding that this type of exercise with appropriate home modifications that were individualized and directed to each unique older adult's home was important. Chris, the next slide. And so some of our overarching outcomes that we found to summarize is that the Hop Up program and those that participated did have a reduction in fall events. It improved their physical outcome measures. Chris mentioned a little bit earlier on some of those things like the short physical performance battery, which includes things like the 5 times sit to stand, and other things like the tug, and some of those different physical outcomes improved, and an improved safety in their lived environment. And the outcome really being that this collaboration between a physical therapist and community centers, or even in some cases, they were just self-referred, they could have been referred by a healthcare provider, provided an innovative and upstreaming direct access healthcare model. Many of the things that you saw that Chris has already talked about aren't really unique. You've probably heard of many of them. They're all within the physical therapist toolbox, but packaging them all together and really using it as a prevention to prevent the fall is the innovative piece of this. And it also, what we suspected, and we'll talk about in a moment, is some of the reduction in financial and potentially personal burden for the older adult as well. Chris. So here is a QR code to that article. And again, lots of information in there if you want to comb through it for some specifics. And so then what we did with that same group, so all 144 participants, is we did a phone call visit with them at 3 and 6 months to look at some of the long-term outcomes and their perceptions down the road from their participation. And we had about 70% of the program participants respond. All of them still had a reduced falls. Now, of course, this was self-reported, and we all know how that goes. Sometimes, well, I didn't really fall, I slipped to the floor type of a thing, but at least they're reported they were still having a reduction in falls. A third of them had continued to make home safety modifications. So, for example, if there was a recommendation for maybe a walk-in shower and they couldn't afford it in that 6-month period, they were still trying to make some of those long-term changes even after the study had finished. Chris mentioned some of the wearable activity monitors. one of the big ones is that we gave them an Omron home monitoring blood pressure unit, and they all really appreciated that, and we're still monitoring their blood pressure, and many were still finding continued benefits from the exercise. But, always a caveat, were they willing to pay the cost? And we estimated at this time the cost to be around $1,200 or so for the therapist, kind of professional fees and like commute and transportation to get there and things like that. Oops, can you go back, Chris? There we go. They were really only willing to pay about 10% of that cost. So we really identified that insurer-supported preventative health programs, including Hop Up PT, were warranted to really shift that healthcare paradigm. So really being able to get this insurer buy-in to help fund some of these prevention programs. So now you can skip forward, Chris. And I'll just mention here, this is the QR code to that long-term study outcome. And the next slide was kind of a pilot study that we initially did between Henry Ford Home Health Care and the Health Life Center, which is in Grosse Pointe, Michigan. So again, in the Southeast Michigan area. And we did a build and infrastructure with billing and documentation with Henry Ford Health System and to look at the pilot and feasibility. So we enrolled 6 participants in this just initial study and looking for individuals that had Medicare or Medicare Advantage types of programs. And we found that basically just like insurance would reimburse the physical therapy visits for rehabilitation, they were reimbursing the prevention piece of this. And I want to just back up for a moment and talk a little bit about Chris and I, knowing that we needed this payment, were able to work with the APTA to meet with the Medicare Innovation Projects. And they actually didn't even know at that point if they would cover prevention. So this pilot helped to solidify, yes, the billing model that's already in place that many healthcare systems are doing with the Medicare Part B reimbursement is acceptable for this approach. So Chris, next slide. And so this is also published, and really in this pilot study, just want to kind of preface that this was in about 2019, 2020 that we launched it, and many of you remember in about March of 2020, crazy stuff happened. And we didn't even have telehealth as a reimbursable item here. So this particular part of the study we weren't able to do any billing for telehealth, but it still had a 4% return, 4% operating margin, looking at those standard Medicare fee schedule for this health system. Chris, you can go to the next slide. So we took that to indicate we probably should move forward and do another level of study. And we enrolled another 53 participants. We had projected about 60, but we got 53 that were enrolled through Henry Ford Health System. We billed all of these as a Medicare Part B or Medicare Advantage from a wide variety of community centers. I think we had 13 different community centers referring into Henry Ford Health System. And researchers on the back end, we were helping with some of the plan of care signing. And the health system did build their Epic EMR documentation system. So that was a fee on their end that they actually built some of our documentation into the EMR to help with the ease of submitting the reimbursement and billing. Next one, Chris. Okay, so here's some of the full reimbursement and administrative outcome data. So Chris, I think there's some clicking here, right? So the first area to maybe look at is the total estimated expenses. So if we added together what we estimated the mileage per visit would be, and I just want to acknowledge, as many of you probably are in rural communities, your cost for mileage could potentially be a little bit higher. So I understand that and I realize it. This was estimated on possibly traveling less distance in a car. And also the amount of time to get the plan of care signed, which we're not going to share all that data today, but it actually took quite a while and was quite a burden to get some of these plans of care signed. And in some cases, the physicians wouldn't even sign it because they didn't think it was medically necessary. So there was some challenges with those plan of care signatures, but we did add in some amount of money for that time spent. Then the salary for the in-person visits was at that time $72 a visit for payment to the therapist, and the salary for the virtual visits about half of that. Remembering that the virtual visits didn't have any commute time, with then the total estimated expenditure of 607. And so the next circle, Chris, there you go. So then when we looked at the average paid of in-person visits with the evaluation and the virtual visits, there was an estimated income of $706, which a project revenue of just about $100 for each person that was enrolled, with, as Chris already kind of foreshadowed, our 14% operating margin for this when we were billing everything correctly and billing for the telehealth visits. So the telehealth visits really added a nice bump to some of that operating margin. Just as a little side note, Henry Ford Home Health Care is a home health care, right? They're treating individuals that are primarily Medicare Part A. So there were some administrative challenges in learning that new system for Medicare Part B. And so some of the data didn't get billed exactly as we would have liked it. So lots of learning in that. But certainly they have within their health system outpatient clinics that are doing Part B. So if they continue to move forward with this, I think they'll partner a little bit more with those entities within their organizations to help with streamlining the efficiencies of some of that billing. Okay, next slide, Chris. So really kind of some of the possible implementation approaches for critical access hospitals. So in thinking of those of you that are on this call, and certainly we're open to questions and discussions because you may even have better insight into how this may help your approach. But we in thinking through this, identified that in-house or community PTs, meaning do you already have community PTs that are connected with your health system, or outpatient clinics that work with your patient populations, working with them to gauge their interest to offering these types of programs as services as a new revenue stream. So that might be a first approach. We found with the physical therapists that have done this, they absolutely love it and really are like, oh, I love being able to see these people to prevent them from having the injury versus just dealing with people after. So we've had really good feedback from physical therapists as to being engaged with this program. Also coordinating with any other referral sources. For example, if your organization has a community partner, a senior center, maybe you already partner with an assisted living facility, or you have physicians that are champions for this type of work. These would be individuals we would recommend you get kind of connected with and discuss kind of looking at more direct referrals to the Hop Up PT program. And we, meaning Chris and I, have resources to train your physical therapist. So we have an online state of Michigan PDR CEU approved training asynchronous module that they can take and get some of their accredited licensing renewal CEUs checked off, but then also be trained in the program, as well as we are certainly willing to do individualized approaches for specific systems that might need specific modifications to the program to best meet their needs. So this can be done by Zoom or in person, but those resources are there. And then once the therapist is trained and we provide them all the resources, documentation, handbooks, patient handouts, all of that's done and available, videos, online videos, then it's really the health system that bills the physical therapy and gets the reimbursement. And we're really out of the loop at that point. And then it's really another approach that we thought would be important is just making sure people are aware of this, educating their referral sources that this is a new type of service that physical therapists can actually be more involved in prevention, to helping to look at potentially some, data collection for readmissions and falls and whatnot. So Chris, the next slide. So I already mentioned there's some already built therapist training modules. And we also have just a free YouTube online training module for community centers and maybe lay people. For example, maybe someone's delivering Meals on Wheels in your community and you want them to look for maybe people who are at risk. We have a 15-minute free YouTube video that they can watch to help guide them in some of this. So Chris, I think the next couple slides have that. Oh, this is actually a website that has all of our resources on it free. This was built through some of the funding through the Michigan Health Endowment Fund. And so everything that we've put on here is freely available for you to use. Next slide, Chris. Yep, here's the ambassador training, as we call it. It's actually, I said 15, it's actually even shorter. It's a 10-minute video that really shows that community ambassador, what they could look for in the older adult. And we have found that those eyes out in the community are essential to connecting those older adults to the physical therapist and to the healthcare system. And then here is the foundational concept training module for the therapist to do, and it's an asynchronous course. And that's really all that we wanted to formally share, but we would love questions. We would love an opportunity to discuss. I think, Amanda, did you ask people to put those in the chat?
Yes, I did. So if you could put your questions that you have in the chat or in the QA box, Chris and Sarah are happy to answer any of those questions that you may have at this time. There might not be.
It's okay if you don't too, but sometimes things pop up or you start talking with individuals within your healthcare system and you remember hearing about this. Certainly you can get a hold of Chris or I at Oakland University. I will type my email into the chat. Arena, so I guess maybe if you're not from Southeast Michigan, Joe Louis Arena doesn't mean anything to you, but I always use my Arena. Maybe there's a better arena up in northern Michigan and rural areas of Michigan, but those are how I remember my last name. So, and then Chris is in there as well. So please reach out to us. We'd love to partner with you and just see if there's things that we can offer to help us all help older adults in Michigan.
Yep, and for those that are still on the call with us, today's slides as well as the presentation will be on the Michigan Center for Rural Health's website here. Usually it's done about by the end of this week, so this will also be available to you as well. Looks like she says, hello, I am coordinating this is from Daniel Griffin. I am coordinating a community paramedicine program in the Saginaw area. Is this training only offered to physical therapists?
Well, technically anyone could take the training, and we can also streamline training to other individuals. I think as far as the reimbursement piece, that's a little tricky if it's not someone who can normally bill for reimbursement, but many of the programming, the Otago exercise program, are available to other disciplines for sure.
Yeah, and I think it's a really I think it's a really innovative process. I mean, probably the one thing is that you may want to still consider having some type of expert, and it could even be an occupational therapist. I know there's other programs where it's an OT, to also consider like identifying some of those multifactorial variables. But then once the therapist has kind of said, yeah, they don't have anything medically going on, or they're not too complex, they could be seen by a community health provider too. So I know some other organizations have done things where they have volunteers coming into the home and coach them. Just to tell a little side story, Sarah and I were kind of working on another project where we got a little bit of money, and we actually tried to train some robots to do the Otago exercise program in anticipation of like the way future. Maybe at some point when we're all old, we have personal assistant robots that can remind us to go through the Otago exercise program. So at some point, maybe we don't necessarily need to have physical therapists come in and do this. The good news and bad news is that when we were teaching the robots how to do the exercises, they fell down way more than the older adults did. So there is no danger of our robot overlords taking us over anytime soon. So we were really pushing technology to have the robots kind of teach them the balance exercises. So so long story short, yeah, I mean, I just think at the beginning, it's a good idea to have someone, some type of medical professional take a peek at them to make sure that they're not, don't have something seriously medically going on, or they truly do need therapy. But then also keeping in mind, even just referring to community programs. There's a ton of community programs that are out there. And Sarah, maybe if we have a few extra minutes, maybe we can even show them the 211 website that we have going on, to kind of talk a little bit about finding resources based on Daniel's question of, hey, I want to send my person to a fall prevention program, but I don't really know where they are and I can't remember them. That's actually something that Sarah and I have also been working on, once we kind of get some of the questions answered. So
Yeah. So, and Jennifer Eiler was kind of on that same vein of just recreational therapists also doing the program with elderly residents of assisted living facilities.
yeah, and I think the Otago exercise, I mean, I think when we're talking about that, I mean, it's even, we've even known some just community workers, who have been trained and certified in things like the Silver Sneakers class or Matter of Balance classes. And I think the big thing is that, part of that training is even finding out who might not be appropriate for it. So I do know many recreation therapists, kind of trained in Matter of Balance and Silver Sneakers and some of those courses. So I do think that once you've kind of gotten past that, like, okay, yes, this is definitely safe for the person, they certainly could do something to that effect. So
Great. Amanda, do you want us to share just really quick that new 211 fall prevention resource
Yeah.
that so
Yeah,
that's
no, I think it's always great to be able to provide the audience with extra resources.
Yeah.
Your 2-on-1 collaboration is important to make sure that people are seeing that's
got it, Sarah.
something that's available to them. So absolutely.
Yep. So I'm just going to kind of show you how I would find it. If some of you may already be familiar with 211, but in case you're not, it's a statewide resource, actually a national resource, but there's the Michigan 211 that provides all the different actually all different social determinants of health resources. Chris and I are currently working with the Michigan Department of Health and Human Services and 211 and the Michigan Falls Prevention Coalition to build fall prevention resources on this site. So if you just Google 211 or call 211, it'll take you right to their page. And you'll see at the bottom, this fall prevention link wasn't there before we started our work. So our very big team of people have now created a fall prevention resource page that will take whoever is on this, healthcare providers, older adults, caregivers, to some basic information and facts about falls. But the important part are these, what we call buckets. So there's these 4 buckets: educational safety and planning, physical health and wellness, daily living support, and then home accessibility modifications. And the idea is that an older adult or their caregiver or healthcare provider could go into this resource, plug in their zip code, find a resource, and it would take them to different things that are available in their community and area. And the phase that we're at right now, Chris is actually leading a task force to continue to get people to and organizations to get their resources on this website so that there's not a lot of dead searches if people put in their zip codes. And I think some of our rural communities are probably the most at risk for some of those dead leads. So you put in a zip code and you don't find anything. These can be in person, they can be asynchronous. So if you know your community group or your healthcare organization are offering Matter of Balance, fall prevention programs, you have physical therapists that specialize in fall prevention evaluations. Maybe you're doing Hop-Up PT for your community. You can put some of these things on 211's website. And we can certainly, that's a whole nother conversation as to how to get on here, but pretty much if you called 211 and asked to get on, they would assess you and make sure that you were appropriate for this and they would add you to it. So in a nutshell, that's kind of the website. Chris and I are currently building a survey and doing a reliability and validity study so that an older adult could go in and answer some questions that would guide them to the right resources. For example, urinary incontinence we know is a fall risk, but people don't always know it is a fall risk. So maybe helping to guide them in urinary incontinence pelvic floor therapists to help with exercises that reduce their incontinence so they're not rushing to the bathroom and having those falls. So lots of different things. We could come back and do a whole nother presentation on that, but hopefully that just gives you a quick overview of that. Yep. Thank you, Amanda, for putting that in.
You're welcome. I'm showing that your your emails only popped over to me.
Oh, okay. Sorry about that,
Yeah,
everybody.
no, that's okay. I'm making
Yeah.
sure that we've
I
got
went in that
out.
whole long story about my last name and then no one even saw
Yep.
it.
That's okay.
Yeah.
So
Good.
we have
Chris,
about
anything you would add to that 211 or is that enough, you think, in a nutshell?
Yeah, the only other thing I was going to say, I was going to ask your permission to show the video, Sarah, if because you're the star of the video.
You can show the video. It's only 30 seconds long.
Okay, yeah, it's a quick
I don't
video
pay
just to
them
show
either.
that
We'll need to go
for
now.
for awareness. Let me share my screen. I think share sound. Oh, I don't know if I can share sound. I don't know why the share sound button is grayed out, but we'll give it a try and see if we can share it. But it's got captions, so it might not necessarily even need the sounds.
Taking steps to stay safe and avoid falling. You don't have to wait for a fall to happen before you get help. It's important to act early. Falls can be scary, but help is just a call or a click away. Dial 211 to connect with a caring expert who can guide you to a local fall prevention program.
I can definitely direct you to some resources. If you just provide me with your zip code, then I can see what's in your area.
Finding fall prevention resources is easy with mi211.org. Start by visiting mi211.org. Click on the fall prevention banner or go directly to mi211.org/fall-prevention. Enter your zip code to find balanced programs, home safety help, and more right in your community. In just a few clicks, you've got local support to help you stay confident and independent. If fall prevention resources are not yet listed in your area, don't worry. New resources are being added all the time. If you're using the phone, an operator can help connect you with resources or explore the MI211 website. Take the first step. Call 211 or visit mi211.org today and stay strong, safe, and independent.
All right, thank you for letting me share that, Sarah.
I'm counting on the cruise with the most traditional.
Oh, what's going on here now?
Been into this, but
No, shut up. Okay, there we go. Good. All right.
Good. So that's actually going to be coming out in a press release from the Michigan Department of Health and Human Services later this year, in Fall Prevention Week. So
Yeah.
Great. Do we have any other questions or comments that we would like to present to Chris and Sarah this afternoon?
Probably the only other thing I'll say while people are thinking of their questions, there is a statewide coalition. It is the Michigan Falls Coalition. And we have a website, just like everything has a website. So if you're looking for more information or you're looking for more resources, or you just kind of want to think about how to do that, the group meets about every other month, Sarah, quarterly, something like that.
yep, they'll meet again in September.
Yeah, so they meet about every other month, and it's free for anyone. You don't have to be connected to a healthcare system. You can be, independent therapy clinics. We have professional organizations. The National Kidney or Michigan Kidney Foundation is on there. Almost all of the area agencies on aging are on there. So I'll put the link in the chat for that as well. And then that way people can visit the website if they're interested in the Michigan Falls Coalition.
And Chris, you do have rural representation within that coalition as well,
Definitely.
correct?
Yes,
Yep.
we have rural representation, and we also have Native American tribe representation in that group as well. So if your rural area also has some tribal communities, we're also making sure that that those individuals' needs are met because they're a unique population that have a unique set of needs. So we want to make sure that these type of things are available to all Michiganders. So if you can't remember it, it's mifallsprevention.org is the website, and I just put it into the chat. So if you're interested in learning more, or you want to sign up to attend the meeting, there's no fee. It's not really like a formal membership organization. Then you can just kind of sign up and then attend the meeting. So no cost to join our dedicated community of people who want to help prevent falls.
Thanks for sharing that.
Right. Yep.
All right, we're coming up on the 5-minute mark. I wanted to give everyone one last opportunity to get any questions in that they had so that we could get them answered for you. I will be sending out just briefly here. I will go ahead and send out the fallprevention.org resource as well in an email that will also contain a link for today's survey for the webinar, but I'll also share Chris and Sarah's email in that as well.
Great. Well, thank you guys for your time. And Amanda, thank you so much for inviting us to this. We're certainly here as a resource. So if there's anything you need related to older adult health or keeping them safe and active or preventing falls, we are a resource. We work for the university. So this is just kind of what we do and how we roll. So this is our passion, and we're here to help anyone, even if you're not close to Oakland University. We're happy to help. Sometimes we've even driven all over the state to help organizations kind of feel a little bit more better and confident in the resources that they can offer to their community members. So we're here. Just give us a holler.
Yep. Thank you, everybody.
Yeah. Thanks, everyone. Thanks for joining. Chris, thank you. Sarah, thank you.
Thanks, guys.
All
Bye-bye.
right. Bye-bye.
Bye-bye.